So typically, for those of you who haven't come to one of our Daisy Awards before, we kind of start here. That way, one, nobody knows where we're going and what department is going to receive the award. But everybody's here, so we get to stay right here today. And really, typically what I would do is I would tell you the story about Patrick and the Barnes family and where Daisy came from. I do it every time so that every new face and every new employee knows the history of Daisy and why we do what we do in recognizing our special nurses. But today, we actually have the Barnes family with us. So Bonnie and Mark Barnes, this is Patrick's parents, and would really like to tell their own story today. So we're going to have them do that. And
thank you, Jill. Good morning, everybody, and thank you all for being up at the crack of dawn. I'm so happy we have a future nurse of America here.
yeah.
First of all, I want you to know how excited we are to be here, especially during Nurses Week. Thank you. Yeah, if you could gather a little bit, it would be easier. I don't have to be back and forth. It is such a joy for us to be here in Maine. Mark and I came from California, and I want you all to know the reason is because of Marianne Ponte, who a year and a half ago emailed me and said, I need you at Nurses Week in Maine 2019, be here. So I don't know if any of you know Marianne very well, but I know you only say yes to Marianne, because I've known her for a long, long time, and I'm sure you have the same impression, that of course we're coming to Maine, so thank you so much for a very warm welcome. We're thrilled to be here. And to get to meet all of you who have sustained the Daisy Award so brilliantly for a long, long time. You are a gift. Paula, you have been a fantastic Daisy coordinator, and for all of us, all of you who are on the committee who brought Daisy here and who have made it so special for your nurses, we're really honored for your caring and support for this program. It is just about 20 years ago now that our son Patrick died of complications of the autoimmune disease ITP. And as you may know, he wasn't a little kid, he was 33, had just given us our first grandchild 6 weeks before he got sick. He went into the hospital, and Mark and I had the great gift of being able to spend this following 8 weeks with him until he passed away in the hospital. And I gotta tell you, it's just, you've been around families like ours. You go through this ridiculous roller coaster of emotions, and suddenly it's over, and now what do you do? How in the world could we fill that gaping hole in our hearts that his death had left? We couldn't think that there would ever be anything positive in our lives again after he died, because he was such a special part of our family. But we had to do something, and we had to find some way to keep his very special spirit alive. And as we talked about those 8 weeks in the hospital, we kept coming back to the only shining light we could think of, and that was Patrick's nurses. And as we reflected on the care we had experienced, which frankly was for the first time in our lives that we had gone through something like this, we realized, of course, we expected that Patrick would get great clinical care, and he did. His nurses were totally competent in dealing with a very complex medical condition. But what we didn't expect was the way the nurses cared for him and for us. Their compassion and sensitivity and kindness just took our hearts, and their hugs meant the world to us at a time we really needed to be held together. So when he died, we just felt compelled to say thank you to nurses for what you all do every day, for not just the huge life-saving things that we know you do, but the little things that make such a difference to patients and families when we are in your truly loving hands. So that's why we created the Daisy Award. Daisy stands for diseases attacking the immune system, since that's what took Patrick from us, and it keeps us really rooted in our experience with his nurses and with him. But we created the Daisy Award as a way for other patients and families and coworkers to tell their stories, just like we tell ours, of the extraordinary care they experience with nurses. Well, we never imagined, just about 20 years later, that there would be 3,702 healthcare facilities and schools of nursing, not only all through the United States, but in 21 other countries, committed to honoring nurses month in and month out with our program. Who would have thought? Who would have thought we'd be here in Bridgton, Maine? We also never would have thought that more than 1.3 million times a patient, a family member, or a coworker would stop and take the time to tell their story, which has only reinforced that we are not the only folks who need to say thank you to all of you. So it is a real joy to be here, and I just want to emphasize the fact that while Mark and I may have founded this, we don't do this work alone. We used to do this work alone, but long ago we realized we couldn't handle it alone. So I want to introduce a few people who are with us right now. Alex Schoen, who's your regional program director for the Daisy Award here in New England. And we have a couple of wonderful industry partners, and we're so excited to have them here. Carlene Kerfoot is the Chief Nursing Officer at API Healthcare. She was the first nurse executive to bring Daisy to an entire health system many, many years ago, serves on our board and is a fabulous friend, guides our work every day. And with her from API is Sarah Nice. Thank you so much, the two of you, for coming to Maine with us. So now that's a very long drum roll to getting to who's winning the Daisy Award today. So Jill, thank you for allowing me to introduce
No,
our
thank
program.
you. That's just a treat. It's just such an honor to have you here. It truly is. And this program has meant a lot to us since we brought it here back in 2011, and it continues to go strong. And I think that just having you here and telling your story just re-energizes all of it, and I think that we will even make it stronger.
Thank you.
So I will read our story. Our Daisy was nominated by one of her colleagues in oncology. This Daisy exemplifies all that is Daisy, as she has been described as a fierce patient advocate who always puts her patients first and demonstrates genuine care and concern for all of them. Countless times she has come in after hours or on weekends or stayed late to accommodate our oncology patients. One such example of many is on a particular Friday, a call came through from the emergency department that an oncology patient was there. After having had a blood clot, he could not afford the very expensive medication for the treatment and was in the ED hoping for a refill. Without hesitation, our Daisy went to the emergency department and started to make phone calls to the patient's specialists and local pharmacies. After hours of extensive care coordination, she was able to arrange for the patient to have his $800 per month medication for $30. This was through a specific program at Central Maine Medical Center's pharmacy.
You know. Come on. She shared this news with the patient, who was tearfully appreciative for the access to the medication that his life was dependent upon. The ED staff was quite appreciative as well. This is just one example of the compassionate efforts that our Daisy, Christine Lint, Karen usually does this because I cry, demonstrates for her patients every day, and we are so proud to have her here as an inspiration. Oh, thank you, Sarah. Thank you all very much.
Congratulations.
Thank you.
What a way to save a man's life.
Thank you very much. Yes, thank you.
You were great work.
I Yes. Around. I had no idea, so.
Your beautiful smile. And I tell everybody, I wanted one of these for so long. And I went on to see if I could, you can't get them, and you have to earn this beautiful stuff. There is no other way to get them.
cheapest find in Zimbabwe.
But these statues, for those of you who aren't aware, they are made they're all handmade by the artists in Zimbabwe. They're all alike, but always just a little bit different. And it really is a gift for both the recipient. They're signed by each artist. And it really helps sustain the artists in Zimbabwe because they really don't have another way to market and sell their work. So they are beautiful.
Gorgeous. Thank you all so much.
The- Just to reiterate a little bit more, the economy in Zimbabwe right now is about 90% unemployment. It's a terribly broken economy. It's been a dictator for many, many years. His replacement is equally as either. people. So there are no tourists to buy anything from the artists. So we have been able to sustain 22 artists in this particular village. They are historically stone carvers. So they are now carving their little hearts out with making these, and we've purchased over the years about 120,000 of these for various DAISY recipients around the world. So you guys who are nurses, Bonnie doesn't like me to say guys, you professional individuals who are nurses, you are sustaining a whole group of people in Zimbabwe. So thank you.
We're a beautiful story. Yes. Thank you.
Thank you.
I like that, professional individual.
Do you have the? Oh, yeah. Oh, do you have the thing? Oh, okay.
I'm going to present this.
All right. That's good.
So I have to tell you why we have to have pins. When Patrick was in the hospital and of course had this gruesome bleeding disorder, I kept looking for other things other than having to always focus on him and his gruesome look. And I discovered this thing you all have about pins. Because all the nurses are wearing all these pins, right? Oh, well, that's really cool. So one of the first things we created after the certificate was when found this pin company in our little town that happened to make pins and designed our DAISY award pin. And it's all because all of you gave us something pretty to look at. So we hope they enjoy it.
Absolutely. Proudly. And Paula has something for you.
She makes them
Every day is
gorgeous. Gorgeous. With a date on it.
So, what we'd like to do is go down to the cafeteria for anybody who'd like to join us. Our cinnamon buns are down there today. So I know you'll all follow us to the cafeteria for those great cinnamon buns. And then we can talk with the Barneses.
Congratulations.
We'll have to get some.